Hey Chris, how you doing?
Hi, Ron. Doing great. How about yourself?
Doing great, man. We got a great topic today. Today we're going to talk about EMR, EHR integrations, and talk about how we integrate. Talk about the interoperability. We're going to talk about the benefits. We're going to talk about why we do it. And this is something we do a lot. You know, I tell people when they call me and we start talking about Clarity's background and what we do, and we talk about the 1,500 websites we've done. You know, I always get questions such like, "Well, what in what verticals?" It's like every vertical, right? I mean, we do portals, online portals for companies that are online. Well, every size company, every single vertical is online. But out of the 1,500 websites we've done, over 200 have been medical. So if I had to pick one single vertical, our biggest vertical that we've ever done is medical. We do a lot of medical. So I'm really excited about this one today because we have so many different cases that we can talk about. Right, Chris?
That's right. Yeah. And, one of the really interesting things about the medical space is a lot of folks, generally, there's a lot of sort of complexity to the way that the security rules and the privacy rules work with HIPAA. And then in addition to that, there tends to be just a general sort of like level of bifurcation within the space because of the nature of how the healthcare providers and the practitioners of the actual healthcare versus the administrative side of the business tend to be sort of somewhat independent, and it's very specialized knowledge, in particular areas of healthcare. And so there's just this natural tendency with the HIPAA side of things, with the detailed level of knowledge necessary to execute and provide healthcare, that all of the parties involved don't necessarily have a lot of tendency to be knowledgeable about everything because it's just so complex. And so one of our big goals here is to essentially demystify that and crystallize specifically what the main thoughts are that you should be focusing on if you have a project that might benefit from integration to an EMR or EHR system. And, we think that this can be really helpful to help allay some of your concerns that you might have a blind spot or a lack of knowledge about something. That's really what we're going to be talking about today. And we really hope that this helps to give you a confidence level based on our experience of what we've seen that is important to consider and how these things should go when done right.
Yeah, I agree with that. So, and that's a really good point that, demystifying, it's a really good word to use for this because there's so much unknown about it. And then there's this big, huge cloud of HIPAA compliance hovering over your head that you're like scared. Most of my clients that call me, they're like, we're worried about HIPAA. We're just not sure. There's so much gray area. Does it apply? Doesn't it apply? Are we going to get fined? And it's funny that the integration isn't even in the top 5 of when people get fined. I mean, when you and I have done some of the webinars, I remember one of the ones we did on right on the HHS Gov site, we did a review on the security breaches, right? And for the last 5 years running, the number one for all 5 reason why and for penalties assessed was for allowing people within your own staff access to PHI data they're not supposed to have. So, for example, you had mentioned the administrative staff, right? Well, if the administrative staff running the hospital has nothing to do with Ron's care other than his billing, then they shouldn't be able to go in and look at Ron's record and see that I have a broken arm or diabetes or anything, right? They can't. That's not part of their purview. Just like in some of the other webinars, I keep using the rad tech, right? If Ron goes in, breaks his arm for an x-ray and goes in, well, the x-ray technician should be able to upload the x-ray, put in their notes, read the chart and put that in the chart, but shouldn't be able to go in and look at the other areas of what medications I'm taking or anything about, diagnoses like a diabetes, anything like that, right? That's not within their purview of taking and reading an x-ray. But it's so easy for people to, historically, every other application in the world, it's like, oh, you need a login here. And we give a login and they have access to everything, right? So it's really easy for hospitals and clinics, especially smaller organizations. And so if you're one of those smaller organizations, this is something we really need to just make you aware of. make sure you think about who should have access to what data, because that is literally the number one reason why people get penalized by the OCR with these fines. Anyway, enough. Let's move on to integration. And I think the number one thing we should start at is why. Why do we need integration, right? I've got hundreds of clients that have come to Clarity asking for integration for many different reasons. So since I've talked a lot, I'm going to actually flip it over to you. Usually I'm the one that always gives the high level stuff and you get to give the fun technical stuff, but I'm going to flip it this time and I'm going to hand it over to you and you tell me why companies come to Clarity for integration.
Yeah, that's a great question. And, I think one of the most foundational aspects of this is automation. What does that mean exactly? And what are some sort of outputs of that? In particular, I would say that there should be a source of truth of information within your organization and for the sort of peripheral dependencies on that. So external contractors, external healthcare providers that are interacting with your team, possibly with external systems, and of course, customers, patients who are receiving healthcare, and making sure that they have, in many cases, the ability through that automation to receive this higher degree of service that includes a self-service capability. So I don't want to have to call and talk to somebody who logs in and looks at this system. I want to be able to go to some portal that isn't, it's not part of the EMR or EHR system. It's a separate portal, but it should have up-to-date information where it's relevant to me, that is securely displayed to me. I have to authenticate and be authorized to see it. But ultimately, this is the power of this integration, is being able to leverage that source of truth throughout all of the different sort of, think of it like a cardiovascular system where it has to get all the way out to the different parts of the limbs of the body, from the heartbeat, which is the EMR or EHR system. It's a similar sort of visual. And, to the extent that we were to say, hey, let's just cut off the blood circulation to your arms are going to die. It's the same
Yep.
thing with this data. You have to have rich data that's relevant, that's getting all the way out to customers, to vendors, and to even different associates at different locations, and being able to work together across different regional boundaries, for example. These are all use cases. Another scenario run is different devices. If you want to look at sort of like different locations and different devices, having integrations is really key for making that happen. And then keep in mind, this is all, like you said, within the context of, it actually is a real security issue. That's very cogent. I mean, it's hard to overstate how serious it is, because like you said, one of the biggest challenges that occurs is there's a data breach. And that's typically the number one issue that you see on the wall of shame with the OCR is, if you have a big enough data breach, you have to self-report. That's part of the regulation. So you see all of this self-reporting, and then, who knows how many data breaches occur consistently that aren't reported, that no one even knows about. Many
Right.
of these, examples like you talked about, they occur where somebody made a copy of something and put it on a system, and then it wasn't realized for, 5 years that it was breached and being shared from. And then, we realized it now, and now we're doing an audit and go back and find all this trail of data, right? And so you want to be careful about accounting for and meeting best practices within this industry, while also being able to actually fully leverage and operate with this data. Because ultimately, you don't want to not take advantage of this data, or your self-service and your customer service capabilities and your vendor interactions and just overall interactions as an organization are going to grind to a halt. So that's the reason generally for doing it. I'm curious, I bet you have some other thoughts on this as well. I'd love to hear those too.
Sure. Yeah. And mine are obviously company specific, right? Because they're the companies that come to me and talk about the projects. I give an estimate and then we throw it over the wall, and your team's the one that does all the automation and does all the engineering, right? So you're in my context, you're probably a little different. For me, they usually come and it's hey, the law says we have to have this interoperability and we have to make this data available to our patients easily. And, I've got 27,000 patients and I don't want to have to manually have those 27,000 patients call my office and then me consistently provide data. That's too much work for our practice. I want to provide up-to-date lab results and proactive notifications to my patients. I want to be able to have them come in and look and see and read all their own past readings from past visits. I want them to be able to see all of their outstanding bills and print their bills and pay their bills online. I want them to be able to a huge big one is I want them to be able to make their own appointments and cancel their own appointments instead of 87,000 people calling my office and being pissed off that they can't make an appointment for a month out. Right.
Yeah.
It's just like, and have to call 27 times to see if there's a cancellation just because they're really hoping to get in next week. Right. I mean, that kind of stuff is such a pain and
pay
causes
their bill, see the status on an order, see the status on a lab result. Yeah. Yeah,
exactly. All of it. And so what I'm going to do here is during some of those things that I just called out, we'll probably pop up some screenshots, and I'll do that throughout this because we've done so many of these that I'll pop up some screenshots throughout the video so you can kind of see videos of, where they can go in. And I might even in my head walk through a demo of one of the ones and kind of walk through and show you what that looks like. So for me, the integration is a lot of it, and we'll just take a really simple one. Doctor patient portal, right? We'll take one of our examples here because I think this one we'll talk about the one we did for the diabetic provider, right? So one of our customers, Acon Laboratories, they provide one of the diabetes testing devices. And one of the things that they did is that for diabetics, normally what they have to do is they get up, every day, every other day, whatever, prick their finger, do the test, and then they have to write their number down in this little black book. Right. And then every 6 months, they take this book to the doctor flips through it for a few minutes and he looks back at 3 months ago, he sees some really bad number and he goes, what the heck was this? And it's like, I don't remember. I guess it's around my birthday. Maybe I was eating a lot of cake, right? They don't know. You shouldn't have done that. Or you should have called the doctor. Well, I didn't know. Or you should have called the hospital, or you almost passed out. The doctor then chastises them for things that they don't know. They're not doctors, right? They're just writing numbers in a book. So Acon decided they wanted to be able to provide better healthcare for diabetics. So one of the things that they did was they put a port, an RS-232, a mini USB port in the device, and they Bluetooth enabled it. And so then they came to Clarity and said, hey, we would like you to design and build us a couple different applications that we could do. So I'm going to walk through the application of this, and I'll show some screenshots here in a minute. So we design and built a mobile app so that the end user would have this mobile app that they could log in and they could see all their own results. It was Bluetooth enabled so that it actually connected to the device and automatically pulled in all of the readings. Now, it did this for two main reasons. One, if when they took a reading and the reading was too high or too low, based on the settings and thresholds that their doctor set, it would automatically ping them in the app and say, hey, you're too high, you need to do X, or you're too low, you need to do X, right? So it could provide this additional threshold of care right at the device for the user. The other thing, because in the background, the mobile app connected to the portal in the background, there was a doctor portal where it was automatically uploading all of the patient's data from all of the people they were caring for diabetes into the doctor's portal. So the doctor was seeing. So I'll show a screenshot here where I put myself and one of my sales guys into the doctor portal. And you can see here, it automatically flags 2 out of 2 patients, and I gave myself really super high data readings. And so you can see down below, it says high variability. And for Philip, I gave him really low readings. So now it says low variability. So very easily in the doctor's office, in the middle of the 6-month treatment, they can see that Ron is struggling and Philip is struggling. They can drill in and see what's going on with Ron and proactively pick up the phone, call Ron, and figure out what the heck's going on and provide that better care. So that's what the USB is for. What the RS-232 port was for is actually even more interesting. I kind of feel like there's not a lot of projects we get to do that are feel good, right? But what ACON did was they took 10,000 of these devices and they shipped them to Africa. And so then what we did was we enabled this platform that we built to work standalone. So a doctor could actually have a copy without the internet of the portal on their laptop, take one device, walk into a village, plug it in with this mini USB cable, plug and play, and they could service the diabetic needs of an entire village with one device, right? No mobile apps, no phones, small village, doctor on a laptop, and they could service and track and do that. So we ended up building 3 different applications. We built the doctor-patient portal, we built a mobile app, and we built the USB plug-and-play app for Windows for the Doctors Without Borders. That was one reason why we would go in and do integration, so that mobile app could automatically upload that data to the doctor-patient portal and provide care. We also built in additional sharing. Chris talked about being able to share with the external network, vendors, things like that. A lot of times people don't understand what that means, but in some cases, for example, let's say I had diabetes, my primary doctor was giving me care. He wants to refer me to a hematologist. Well, I have readings for let's make it up. I have readings for the last 5 years. How does that hematologist get all those medical records or get access to those records very easily and can see that without either sharing or integration? And so a lot of times you'll have clinics and hospitals and different other organizations that can be interconnected for this interoperability to be able to share data with the specialists that they work with when care has to be, and I don't know if the right word is, I guess it's referred. I was going to say escalated, but referred to a specialist. So anyway, for me and my purview, most of the integration of these doctor-patient portals, and we've got a lot of clients that have designed medical devices that need integration, and then a lot of clients that want doctor-patient portals that need integration for. And so now that we know the why, let's talk about the specific. You mentioned the word automation, and I gave a couple different examples, but let's dive in just a little bit before we talk about the integration, and let's dive into what kinds of data and what actually is transferring back and forth. We mentioned a couple high level, but let's just dive into that a little more. I'll let you take the first swing at this one.
Yeah. So I think in general, anything that's available within the EMR or EHR generally is available. In particular, specifics on this would be there are protocols, as they're called, and you can sort of think of this as like a package type where you can put data in and move it from the EMR EHR to some other system, or put data in from that other system and move it to the EMR EHR. This is called a protocol. So you might have a box, you could have a bucket, you could have a wheelbarrow. You can move, and the protocols that are used are HL7, and there are different versions of HL7. So it's HL7v2, v3, etc. Then you also have FHIR, FHIR, and these are different protocols. Well, the protocols have different entities and fields that we can interact with as a base part of that protocol. Just like a box or a bucket might have like compartments in it. It's the same idea with these different protocols. So these sort of like base schemas that we get to use, in particular for FHIR, for example, there's a website that is used within the entire EMR EHR space, and a group that decides on what the schema is. So what entities and fields. Think about things like appointments, patients, procedures, being able to look at all of the details around billing, any kind of healthcare records, insurance, medication, all of these types of entities, as I'm calling them, are within the EMR EHR system. And then you also have the sort of customizations that are unique to your organization. So most organizations are going to customize to some extent, and we want to be able to capture this as well. So these are all, just as a general sort of thought, these are all sort of, baseline entities and fields. a lot of our customers will also have unique scenarios that they need integrations for. And typically that data is going to be encompassed with the HL7 or the FHIR, for example. If it isn't, there's pretty much always a way to get at the data as needed. It just can be more complex if it's not included in FHIR or HL7. So we'll actually put the links to those into the description. So take a look at the links for these lists of entities and fields. And then one of the things that I think is really helpful too, Ron, is all of these different EMR, EHR systems, because of the interoperability rules within HIPAA in particular, there's sort of like a built-in forcing function for all of them, where they're going to standardize to be able to meet the requirements of interoperability. And so typically, there is the capability for FHIR and HL7 that's just off the shelf with all these EMR, EHR systems. So that's a really powerful thing if you're evaluating doing an automation or an integration with your EMR, EHR system. You're depending on your system, you're pretty much, is a high likelihood that you're going to have what you need from an API perspective.
Yeah, that's true. And you probably, I mean, there's really only there's 4 main, and I've been here 11 years and all the integrations, and there's only 4 different APIs or protocols, as Chris just called it, that I've ever even heard of in all of these EMRs that have been introduced, right? FHIR and HL7 are the 2 most popular. And then I've heard of Unity and Acuity, right? But I know right off the top of my head that Epic, eClinicalWorks, Athena, Cerner, Allscripts, and a couple others that I just heard in the last couple of weeks all use FHIR, right? So if you want to talk about it in layman's terms, a protocol is a language. If there is only 4 languages in the world, Spanish, German, English, French, whatever, if those are the only 4 languages and every single application in the world spoke that, then as long as you could speak those 4 languages, then you can interoperate and interconnect with every single person in the world. If you think about it that way, that's kind of what we're talking about. So as Chris just made that comment, he says, as you think about your EMR and you think about the other organizations you're trying to connect to, the question you're asking them is, do you know what protocol your API is? Do you have FHIR? Do you have Acuity, Unity, or HL7? How are we connecting with you? Right. And so the great thing about it is, as developers, as us, as we learn one of those languages, let's call FHIR French, since it starts with an F. If we speak French and we speak FHIR, then that means we can literally go out with making small modifications and integrate Epic to ECW to Athena to Cerner to Allscripts, and every hospital and clinic that are using those, we could interconnect them all and they could share information back and forth. Right. I mean, that's really what the integration is. And so those integrations can automate and provide additional care for anything you want. Patient records. And Chris Carty went through a few of these, lab results, patient records, billings, codings, communicating with the doctor, viewing your own appointments, scheduling your own appointments, canceling your own appointments, initiating telehealth sessions, all kinds of stuff. And we have applications that we've designed and built. So I would recommend that if you want to see some of this stuff in action, please go out, hit our website, clarity-ventures.com, click on the button, schedule a demo, come see us. It's also down in the description of the video. I'd be happy to do a live demo for you. You can have a free consultation. We'd love to offer a complimentary discovery of your project and of your project needs, and talk through your project. Is there anything else you wanted to cover, Chris?
I would just say that's exactly it. Feel free to reach out to us and check out the resources. There are some really helpful resources. And until then, we'll look forward to seeing you guys in the next video. Thanks for watching.
Thanks, Chris. Bye for now, everyone.
Thanks, Ron. Bye for now.